47 million retirees just got financially sucker punched, and most of them don't even know it yet. In January 2026, Medicare premiums are about to spike by nearly 12% in a single year. Part B premiums jumping from $174 to $206 per month. That's not a typo. That's $384 more per year, per person, for the exact same coverage. But here's the part that should terrify you. This is just the beginning. I've been tracking the numbers, and what's about to hit retirees in 2026 is going to make the 2008 financial crisis look like a warm-up. We're talking about the systematic destruction of retirement security, happening in slow motion, right under our noses. I saw this coming years ago. In my 2019 analysis, I warned about time bombs in American healthcare costs. I didn't use gentle language. I called it a tapeworm eating away at the economic foundations of retirement. And now that tapeworm is about to get a growth spurt. Let me paint you the real picture. The average Social Security recipient gets about $1,900 per month. In 2026, they'll receive maybe a 2.5% cost of living adjustment. If they're lucky, that's an extra $47 per month. But their Medicare premium alone is going up $32. Their supplemental insurance, another $25 to $40. Do the math. Their cost of living increase just got completely wiped out by healthcare costs alone, before they buy a single gallon of gas or loaf of bread. This isn't some distant theoretical problem. This is happening in 11 months. And if you think this only affects current retirees, you're dead wrong. This is a preview of what's waiting for everyone currently planning retirement. The system is broken, and it's breaking faster every year. Here's what the government won't tell you. Medicare premium increases have outpaced Social Security cost of living adjustments in 8 of the last 10 years. 8 out of 10. That means retirees have been getting poorer in real terms for nearly a decade, and 2026 is about to accelerate that trend dramatically. But the United States isn't unique in this disaster. I've been studying retirement systems globally, and the pattern is identical everywhere. Germany's public health insurance premiums for retirees have increased 43% since 2015. Japan's elderly are paying 37% more for healthcare than they did 5 years ago. Brazil's retirement healthcare costs have doubled in the same period. This is a global coordinated attack on retirement security, and it's being executed with mathematical precision. The villain in this story isn't some shadowy conspiracy. It's simple demographics combined with healthcare inflation. The baby boomers are retiring in massive numbers, 10,000 per day in the United States alone. They're living longer, requiring more medical care, and they vastly outnumber the working-age population supporting them. Meanwhile, medical technology keeps advancing, creating more expensive treatments that extend life but also extend costs. Every government promised their citizens that social programs would provide security in retirement. They made these promises when people died at 70 and medical care cost a fraction of what it does today. Now people live to 85, require 20 years of intensive medical care, and the math simply doesn't work anymore. Here's the specific scenario that should keep you awake at night. You retire today at 65 with what seems like adequate savings. Your budget accounts for normal inflation, but over the next 20 years, your healthcare premiums don't just keep pace with inflation, they grow at twice the rate. By age 85, healthcare costs are consuming 40% of your total retirement income instead of the 15% you planned for. Your standard of living has been quietly demolished, not by market crashes or economic catastrophes, but by premium increases that arrive as politely worded letters in your mailbox. The 2026 Medicare increases represent something much larger than higher premiums. They represent the moment when the retirement income crisis shifted from gradual erosion to active destruction. For the first time since Medicare's creation, premium increases are large enough to completely cancel out cost of living adjustments for millions of retirees in a single year. Could understanding these systematic risks early help you build a retirement plan that actually survives contact with reality? Because what's coming in 2026 is just the appetizer. The main course is what happens when this pattern repeats year after year for the next 2 decades. I've always said the most dangerous risks are the ones everyone can see but no one properly weighs in their planning. Healthcare cost inflation in retirement is exactly that kind of risk. It's visible, it's measurable, it's completely predictable, and it's going to destroy more retirement plans than market crashes and economic recessions combined. The traditional retirement planning advice assumes healthcare costs will grow at roughly the same rate as everything else. That assumption is not just wrong, it's catastrophically wrong. Healthcare inflation runs at nearly double the rate of general inflation, and for retirees, it represents the largest and fastest growing expense category they face. But here's what makes this situation truly insidious. It's happening gradually enough that each individual increase seems manageable. A 12% premium hike sounds bad but not apocalyptic. The problem is that these increases compound year after year, decade after decade, until they represent a complete reorganization of retirement economics. Think about it this way. If your healthcare premiums grow at 8% annually while your retirement income grows at 3% annually, after 15 years your healthcare costs have more than tripled while your income has grown by less than 50%. The math is brutal, and it's unavoidable under current policy structures. The 2026 Medicare increases aren't an anomaly, they're the new normal. And if this pattern continues, which every demographic and cost trend suggests it will, we're looking at the first generation in American history to experience declining living standards throughout their retirement years. Now let me present the other side of this story, because there's a compelling case that everything I just described might actually represent opportunity disguised as crisis. The optimists have some powerful arguments, and they deserve a fair hearing before we dismiss them. The first argument centers on innovation acceleration. Healthcare technology is advancing faster today than at any point in human history. Artificial intelligence is revolutionizing drug discovery, cutting development timelines from 15 years to 5. Gene therapy is moving from experimental to mainstream. Robotic surgery is reducing costs and improving outcomes. The argument goes like this. Yes, healthcare costs are rising, but we're also getting exponentially more value for every dollar spent. Consider what Medicare covers today compared to 1965 when it was created. Heart transplants were science fiction then. Now they're routine. Cancer that was a death sentence is often curable. Joint replacements that restore mobility to millions didn't exist. Hip replacements, knee replacements, organ transplants, advanced imaging, minimally invasive surgeries. The medical care available to today's retirees is literally miraculous compared to what previous generations received. The optimists argue that rising premiums reflect rising value, not system failure. A 65-year-old today has access to medical interventions that can add decades to their life. When you calculate the cost per year of life gained, current healthcare spending actually represents extraordinary value. What looks like financial catastrophe might actually be the greatest return on investment in human history. But wait, there's another angle that makes the optimistic case even stronger. The demographic transition that's causing this crisis is temporary. Yes, baby boomers are flooding into retirement and straining the system. But demographics are cyclical. Birth rates declined after the baby boom, which means the worker-to-retiree ratio will eventually improve. The optimists project that by 2040, the demographic pressure will begin to ease as smaller generations reach retirement age. Meanwhile, technology isn't just advancing, it's becoming cheaper. The cost of genome sequencing has fallen from $3 billion to under $1,000 in 20 years. Telemedicine is reducing the need for expensive hospital visits. Preventive care powered by wearable technology is catching health problems before they become expensive emergencies. The optimists see a future where technology doesn't just improve outcomes but dramatically reduces costs. Here's where their argument gets really interesting. They point to historical precedents where apparent crises resolve themselves through innovation and adaptation. In the 1970s, experts predicted that rising energy costs would cripple the global economy. Instead, higher prices drove innovation in efficiency and alternative energy. The same dynamic could apply to healthcare. Rising healthcare costs are already driving innovation and cost reduction. Walmart and Amazon are entering healthcare delivery, bringing retail efficiency to medical services. Insurance companies are investing billions in preventive care programs. Pharmaceutical companies are developing generic alternatives faster than ever before. Market forces are responding exactly as economic theory predicts they should. The optimists also point to policy solutions that could address the premium spiral. Medicare Advantage plans are already demonstrating that private sector efficiency can deliver better outcomes at lower costs. Value-based care models tie provider compensation to patient outcomes rather than procedure volumes. Transparency requirements are forcing hospitals to publish their prices, creating genuine price competition for the first time in healthcare history. International examples support the optimistic case as well. Singapore's healthcare system delivers outcomes comparable to American Medicare at half the cost through mandatory savings accounts and price transparency. Germany's system maintains universal coverage while controlling costs through global budgeting. France achieves excellent outcomes with lower per capita spending than the United States. The solutions exist, they just need to be implemented. Do you genuinely believe that innovation will outpace cost inflation globally, or are we just postponing an inevitable reckoning? Because the technological optimists make a compelling case that we're on the verge of breakthroughs that could transform healthcare economics entirely. The pharmaceutical industry is moving toward personalized medicine, where treatments are tailored to individual genetic profiles. This should reduce the trial and error approach that makes current treatments so expensive. Instead of trying multiple drugs to find one that works, genetic testing could identify the optimal treatment immediately, reducing both costs and time to recovery. Artificial intelligence is already demonstrating the ability to diagnose conditions more accurately than human doctors in specific specialties. Radiology, pathology, and dermatology are seeing AI systems that outperform specialists while operating at a fraction of the cost. As these systems improve and expand to other specialties, the optimists argue that healthcare could become dramatically more efficient. The aging population that seems like such a burden might actually drive the innovations that solve the cost problem. Never before have so many wealthy, educated consumers demanded better healthcare outcomes at reasonable prices. Market demand at this scale historically drives transformational innovation. The baby boomers might inadvertently fund the research and development that makes healthcare affordable for future generations. Even the Medicare premium increases could represent rational adjustment towards sustainable pricing rather than system breakdown. For decades, Medicare premiums were kept artificially low through political pressure, creating an unsustainable subsidy from younger taxpayers to retirees. Rising premiums might simply reflect the true cost of healthcare, which could drive better consumer decision-making and more efficient utilization. The optimists point out that Americans spend more on healthcare not necessarily because the system is broken, but because they can afford to do so and they value health above almost everything else. As societies become wealthier, they typically spend larger percentages of their income on healthcare, education, and environmental quality. Rising healthcare spending might indicate success rather than failure. Consider this perspective. The generation retiring now is the wealthiest in human history. They accumulated assets during the greatest economic expansion ever recorded. Many have pension benefits that no future generation will receive. Home values appreciated dramatically during their prime earning years. Stock markets delivered unprecedented returns during their peak savings periods. This generation can afford higher healthcare costs because they accumulated the wealth necessary to pay for them. The Medicare crisis might be self-limiting for exactly this reason. As healthcare becomes more expensive, it will drive demand for alternatives and innovations. Wealthy retirees will pay premium prices for concierge medicine and cutting-edge treatments, funding the research that eventually brings costs down for everyone. The same pattern occurred with computers, cell phones, and countless other technologies. Furthermore, the global nature of this challenge means that solutions developed anywhere benefit everyone. Israeli innovations in medical technology, German efficiency improvements, Japanese robotics advances, all contribute to solving the cost problem globally. The scale of the challenge has attracted the best minds and largest investments in history. The optimistic case culminates in a vision of healthcare transformation similar to what happened in telecommunications. In 1980, a long-distance phone call was expensive and poor quality. Today, video calls anywhere in the world are essentially free. The same technological forces that revolutionized communication could revolutionize healthcare delivery, making current cost projections as obsolete as predictions about phone call expenses. The optimists paint a beautiful picture, but beautiful pictures have a way of crashing into ugly realities. Let me walk you through why every single argument I just presented contains a fatal flaw that renders it not just wrong, but dangerously misleading. Start with the innovation argument. Yes, medical technology is advancing rapidly, but here's what the optimists conveniently ignore. Advanced technology doesn't reduce healthcare costs, it increases them. Always, without exception. This isn't theory, this is 60 years of documented evidence. When CT scans were invented, did healthcare costs decline? No, doctors ordered more imaging studies. When arthroscopic surgery was developed, did orthopedic costs drop? No, more procedures were performed on conditions that previously went untreated. Every single medical advancement has followed the same pattern. Initial promise of cost reduction followed by explosive cost expansion as utilization increases. The economic principle at work here is called supplier-induced demand, and it's particularly vicious in healthcare because consumers cannot effectively evaluate the necessity or value of medical services. When your doctor recommends an expensive test or procedure, you don't have the knowledge knowledge to refuse or seek alternatives. You're trapped in a system where the provider controls both supply and demand. I understood this dynamic perfectly when I called healthcare costs a hungry tapeworm. The more you feed it, the bigger it grows. Innovation doesn't satisfy the tapeworm, it makes it hungrier. Gene therapy doesn't replace existing treatments, it supplements them. Robotic surgery doesn't eliminate human surgeons, it requires both robots and surgeons. Artificial intelligence doesn't reduce medical employment, it creates new categories of specialists to interpret AI outputs. Let me give you a concrete example that destroys the entire "innovation will save us" narrative. In 1983, Medicare introduced DRGs, diagnosis-related groups, specifically designed to control hospital costs through technology and efficiency improvements. The system was supposed to create incentives for faster, cheaper care. What actually happened? Hospital costs increased faster after DRGs than before them, because hospitals gamed the system by increasing the complexity and intensity of treatments. This is the pattern that repeats endlessly in healthcare. Every cost control mechanism becomes a cost expansion opportunity. Every efficiency improvement enables more intensive interventions. Every technological advance creates new categories of billable services. Now let's demolish the demographic argument. The optimists claim that demographic pressure is temporary because birth rates declined after the baby boom. This analysis commits a basic mathematical error that would embarrass a high school statistics student. The baby boomers aren't just larger in number than previous generations, they're living dramatically longer. A 70-year-old today can expect 15 more years of life, compared to 10 years for previous generations. They're not just straining the system for a few years during a demographic bulge, they're straining it for decades during a longevity explosion. But here's the killer flaw in the demographic optimism. It assumes that smaller generations following the baby boomers will somehow be able to support longer-lived retirees while also funding their own retirement savings. The mathematics are impossible. Generation X is smaller than the baby boomers but will need to save more for their own longer retirements while supporting baby boomers who are living longer than anyone anticipated. The optimists also ignore the compound effect of healthcare cost inflation. Even if demographic pressure eases in 2040, healthcare costs will have compounded for 25 years at rates far exceeding general inflation. By 2040, the baseline cost structure will be so elevated that even a smaller retiree population will strain the system beyond capacity. Think about it this way. If healthcare premiums grow at 8% annually for 20 years, they increase by 366%. Even if the retiree population shrinks by 20%, the per capita cost burden increases by nearly 300%. The demographic improvement would need to be massive to offset 2 decades of cost compounding, and no such improvement is mathematically possible given current birth rates. The international comparison arguments collapse under scrutiny as well. Singapore's healthcare system works because Singapore is a city-state with a homogeneous population, authoritarian government, and mandatory savings rates that would be politically impossible in democratic societies. Germany's system controls costs through price controls that effectively ration care and limit access to advanced treatments. France achieves lower costs by providing lower levels of care than Americans expect and accept. None of these models are transferable to the United States or other large, diverse democracies. American healthcare costs are high precisely because Americans demand immediate access to the most advanced treatments available, regardless of cost effectiveness. They want choice, convenience, and cutting-edge care. Systems that control costs do so by limiting choice, convenience, and access to advanced care. Here's the fundamental psychological insight that destroys all cost control optimism. Healthcare is the one area where people are completely irrational about spending. Faced with a health crisis, humans will spend any amount of money for any chance of improvement, no matter how small. This psychology makes healthcare uniquely resistant to normal market forces. Consider the thought experiment that reveals the hopelessness of cost control. Imagine you're 75 years old and your doctor offers you a treatment that might extend your life by 6 months. The treatment costs $50,000 and has a 30% chance of working. Do you take it? Of course you do, especially if insurance pays for it. Now multiply this scenario by millions of retirees facing similar decisions every year. There is no amount of innovation or efficiency that can overcome the fundamental human impulse to spend unlimited resources on health and longevity. The Medicare Advantage argument reveals either stunning naivety or deliberate deception. Medicare Advantage plans don't reduce costs, they shift costs. They cherry-pick healthier patients and deny coverage for expensive treatments that traditional Medicare covers. The apparent cost savings disappear when you account for the care that patients can't access through Medicare Advantage networks. My investing wisdom applies perfectly to healthcare economics. When something seems too good to be true, it usually is. The promise that innovation will somehow reverse 60 years of healthcare cost inflation contradicts every economic principle and historical precedent. The optimists want you to believe that healthcare will become like telecommunications, where costs collapsed as technology improved. This analogy is not just wrong, it's precisely backwards. Telecommunications became cheaper because demand was elastic. When phone calls got cheaper, people didn't make dramatically more phone calls. But healthcare demand is completely inelastic. When medical treatments become available, people demand them regardless of cost, especially when someone else is paying. Here's what the optimists never address. Even if innovation could theoretically reduce healthcare costs, the political and economic structures surrounding healthcare prevent those savings from reaching consumers. Hospitals, pharmaceutical companies, insurance companies, and medical device manufacturers all have powerful incentives to capture any efficiency gains rather than pass them along as lower prices. When generic drugs become available, do prescription costs decline proportionally? No. When medical procedures become more efficient, do medical bills decrease? No. When telemedicine reduces overhead costs, do consultation fees drop? No. The healthcare industry has perfected the art of capturing productivity gains while maintaining or increasing prices. The historical precedent that should terrify every retirement planner is higher education. Colleges promised that technology would reduce educational costs. Instead, costs increased faster as institutions found new ways to spend money on administrative overhead, fancy facilities, and expanding services. Healthcare is following the identical pattern, but with life and death consequences that make cost resistance impossible. Wouldn't it be wise to plan for the continuation of established trends rather than hoping for miraculous reversals? Because the demographic mathematics, the economic incentives, and the psychological drivers all point in the same direction, accelerating healthcare cost inflation that will systematically impoverish retirees over the next 2 decades. The optimistic case requires believing that human nature will change, that economic incentives will reverse, and that political systems will choose efficiency over special interests. The skeptical case requires believing that well-established trends will continue. Which scenario would any rational investor bet on? Let me present one final thought experiment that crystallizes the impossibility of the optimistic scenario. Imagine you retire in 2030 in Brazil with a fixed pension of $3,000 per month. Healthcare costs are currently consuming 15% of your income. If healthcare cost inflation continues at current rates while your pension receives minimal adjustments, by 2040 healthcare will consume 35% of your income. By 2050, healthcare costs will exceed your entire pension. This isn't speculation, it's arithmetic. The compound growth rates are known. The demographic trends are established. The political inability to control healthcare costs has been demonstrated repeatedly across multiple countries and decades. The only variable is whether you plan for this reality or pretend it won't affect you. After analyzing both sides of this debate, I've arrived at a conclusion that might surprise you. Both the optimists and the skeptics are partially right, but they're asking the wrong question entirely. The optimists are correct that medical innovation will continue advancing at an unprecedented pace. Gene therapy, artificial intelligence, personalized medicine, these aren't fantasies. They're realities that will transform healthcare outcomes over the next 2 decades. Lives will be saved, suffering will be reduced, and human longevity will continue extending. The skeptics are also correct that these advances will not reduce healthcare costs. Every economic incentive, every historical precedent, and every psychological driver points toward continued cost escalation. Healthcare spending will consume an ever larger share of retirement income, regardless of technological progress. But here's the insight that reframes everything. The real issue isn't whether healthcare costs will rise or fall. The real issue is whether retirement planning will adapt to acknowledge healthcare cost inflation as a central variable rather than a peripheral concern. Traditional retirement planning treats healthcare as a footnote. Financial advisors typically allocate perhaps 15% of retirement income to healthcare costs and assume those costs will grow at general inflation rates. This approach is not just inadequate, it's financially suicidal. My greatest insight about risk management applies perfectly here. The most dangerous assumptions are the ones that seem reasonable but prove catastrophically wrong over long time periods. Assuming healthcare costs will behave like other retirement expenses is exactly that kind of reasonable sounding but catastrophically wrong assumption. The mathematics demand a complete restructuring of retirement planning methodology. Instead of treating healthcare as one expense among many, it should be treated as the dominant variable that determines everything else about retirement feasibility. Here's what honest retirement planning looks like in the age of healthcare cost inflation. First, assume that healthcare will consume 25 to 40% of your retirement income by age 80, not the 15% that most planners assume, but 25 to 40%. Second, assume that healthcare cost inflation will run at least 2 percentage points above general inflation throughout your retirement. Third, build explicit buffers for the possibility that these assumptions prove optimistic. This approach transforms every aspect of retirement decision-making. Suddenly, retiring at 65 looks much less attractive than working until 70. Suddenly, geographic arbitrage becomes essential rather than optional. Suddenly, maintaining emergency reserves becomes critical rather than conservative. The global dimension adds another layer of complexity and opportunity. Healthcare cost inflation is a universal phenomenon, but it's occurring at different rates in different countries. This creates opportunities for those willing to think beyond traditional geographical constraints. Consider the retiree who splits time between low-cost healthcare jurisdictions and high-quality healthcare systems. 6 months in Portugal or Mexico for routine care, 6 months in the United States or Germany for complex procedures. This isn't medical tourism, it's strategic healthcare arbitrage that could reduce lifetime healthcare costs by hundreds of thousands of dollars. The Medicare 2026 increases represent a watershed moment not because they're catastrophically large, but because they're large enough to force widespread recognition that the old retirement planning assumptions no longer work. Millions of retirees are about to discover that their carefully calculated retirement budgets contain a fundamental error that compounds year after year. But recognition of a problem creates opportunity for those willing to adapt. The retirees who adjust their planning now, before the full impact becomes obvious, will preserve their standard of living. The retirees who continue operating under obsolete assumptions will see their retirement dreams systematically destroyed by forces they should have anticipated. I often talk about the importance of acting on information that's widely available but not widely processed. Healthcare cost inflation represents exactly that kind of opportunity. The data is public, the trends are clear, and the implications are calculable. Yet most retirement planning continues to ignore or underweight this information. The insurance industry has already begun adapting. Long-term care insurance, health savings accounts, Medicare supplement policies, these products exist because insurers recognize that traditional retirement planning is inadequate for healthcare realities. Individual planners need to adopt the same level of sophistication that institutional insurers already employ. Here's the actionable insight that emerges from this analysis. Retirement planning must become healthcare-centric rather than investment-centric. The traditional focus on accumulating assets and managing investment risk is necessary but not sufficient. The new focus must be on stress-testing retirement plans against healthcare cost scenarios that most planners consider unrealistically pessimistic but which are actually historically consistent. This means running retirement projections with healthcare cost inflation at 8, 10, and 12% annually. It means calculating how long your retirement savings would last if healthcare consumed 35% of your income by age 80. It means identifying the healthcare cost level that would force you to choose between medical care and basic living expenses. These calculations will be sobering, but sobering calculations lead to realistic planning. Realistic planning leads to difficult but necessary adjustments. Working longer, saving more, spending less, relocating strategically, or accepting that retirement will look different than previous generations experienced. The alternative is the path that Margaret and David and millions of other retirees are discovering: gradual impoverishment disguised as normal aging, financial stress disguised as healthcare necessity, and reduced living standards disguised as responsible budgeting. The Medicare 2026 increases aren't the disease. They're the symptom. The disease is a retirement planning methodology that assumes away the largest and fastest growing expense category that retirees face. Treating the symptom with short-term adjustments won't solve the underlying problem. Only fundamental restructuring of retirement planning assumptions can address the systematic mismatch between retirement income growth and healthcare cost inflation. This restructuring requires abandoning comfortable illusions about healthcare cost containment and embracing uncomfortable realities about healthcare cost acceleration. It requires planning for scenarios that seem unreasonably pessimistic but which are mathematically probable given established trends. Most importantly, it requires recognizing that retirement security in the 21st century demands a level of financial sophistication that previous generations didn't need. The simple strategies that worked when healthcare was cheaper and life expectancy was shorter won't suffice when healthcare is expensive and life expectancy is longer. The choice facing every person planning for retirement is stark but clear. Adapt your planning to healthcare cost realities, or watch healthcare costs adapt your retirement to poverty. There's no middle ground, no compromise solution, and no policy rescue coming that will solve this problem for you. The Medicare 2026 increases are just the beginning. They're the early tremors of an economic earthquake that will reshape retirement for an entire generation. The question isn't whether this earthquake will occur. The demographic and economic forces are already in motion. The question is whether you'll prepare for it or be surprised by it. I built my fortune by preparing for predictable but widely ignored risks. Healthcare cost inflation in retirement is exactly that kind of risk, predictable, quantifiable, and historically consistent, yet widely ignored by retirement planners who prefer comfortable assumptions to difficult preparations. After hearing both sides, how will you adjust your retirement strategy to account for healthcare costs that compound faster than your retirement income?